Hi, everyone. Welcome to the show. I'm Dr. Nicole, and today we're going to be talking about child behavior challenges through the lens of how our attitude and behavior as adults impacts the behavior of our children. Typically, when we think about children exhibiting challenging behaviors, we focus on what they're doing, right? But it's critically important to focus on what we as the adults are doing, because if we want our children to change, then we need to be willing to examine ourselves and make some changes as well. It was several years ago when I read a book about this by Dr. Mark Durand called Optimistic Parenting. And it mirrored exactly what I've seen in my work with families, both as an educator and a psychologist, that the attitude that adults bring to the situation makes a tremendous difference in whether kids improve or not. And he's going to talk with us about what the research shows, what it means to be an optimistic parent, and why it's so important. And I feel like with everything that we've got going on in the world right now, it's more important than ever before. So let me tell you a bit about him. He's a professor of psychology at the University of South Florida, St. Petersburg. He's received over $4 million in federal funding to study the nature, assessment, and treatment of behavior problems in children with disabilities. Before moving to Florida, he served in a variety of leadership positions at the University of Albany, where he established the Center for Autism and Related Disabilities at the University of Albany, SUNY. He serves on a number of editorial boards, reviews for dozens of journals, and has over 100 publications on functional communication, educational programming, and behavior therapy. He has authored several books on addressing behavior challenges in children, including sleep issues, and we use that book all the time in the clinic as well, and it's wonderful. Dr. Durand developed a unique treatment for severe behavior problems that is currently mandated by states across the country and used worldwide. He's also developed an assessment tool that is used internationally and has been translated into more than 15 languages. I mentioned his book, Optimistic Parenting. It is absolutely a favorite of mine, dog-eared and well-worn. I refer to it often in practice. It's such a pleasure to have you on the show today. Welcome, Dr. Durand.
Thank you, Nicole, and hello to everybody.
So great to have you here, especially during this time when parents are spending more time than really ever before with their children, with schools being closed and programs not happening the way that they typically do. So I feel like the timing couldn't be better for us to be having this conversation. I think let's start with the term optimistic parenting. What led you to use that term? Why do you believe that's so important?
Let me give you some background. I was trained behaviorally, and when I worked in a clinic, experimental clinic for children with autism who had severe behavior problems. And the philosophy always was, if the program's not working, it's not the child's fault. It's their fault. I somehow didn't design it properly. I need to break down steps more. I need to use different reinforcers. And I like that because that was, a more optimistic way of looking at what we were doing. However, I also worked with parents and teachers, and I might touch on the teacher part of this too. But I worked with parents who, as you said, we developed some treatments for severe behavior problems. Just couldn't or didn't do it. They didn't go through on the intervention. So we knew, and there are hundreds of studies on this technique, we know it can work, aren't doing it. And me and my colleagues at the time blamed the parents. And basically, they're not doing their job. They maybe stressed, maybe, they're not motivated enough. I'll give you an example of sleep. A little girl that we were working with, and she tantrumed so much at bedtime in the middle of the night. Her father, who was a surgeon, couldn't sleep at home. He had to sleep at the hospital. And that caused all sorts of problems in the family. And the mother was beside herself. So we developed a number of different programs, and they just didn't get carried out. So one night I just said, look, tonight, when she comes out of her bed and she comes into your room, just walk her back to her room. Put her into bed, close the door, and let's just see what happens. Nothing earth-shattering there. I called her the next day, said, how'd it go? She goes, I didn't do it. I let her get back into bed with me, and then she fell asleep. So we were talking as a team about that, and again, kind of saying, well, maybe she's not motivated enough to work on this right now. She'll come back. And she never came back. And so I started to look at, if I think children who we give them programs aren't, they're not progressing, I didn't do it right. Well, if I gave a parent a plan and it didn't work, whose fault is that? And that's my fault. I just didn't do it right. So we did a series of studies looking at, I was interested in looking at how children ages 3 to 6, looking at their behavior problems at 3 and following them up for 3 years, what would predict the children that would get better, their behavior problems would reduce, or children that got worse or stayed the same. And you would think it was, the severity of the disability or the severity of the behavior problem at age 3, but that wasn't the best predictor. The best predictor was pessimism in the family. If parents were pessimistic about themselves or about their child's ability to change, and we'll talk a little bit about the different aspects of that because there's a number of different aspects, then they just gave up. And so, we'd see parents who, at the dinner table, a child is crying, give him a cookie, so he'd stop crying. And I always used to say to people, look, they're not stupid. We gave them parent education. They know they're not supposed to do that. But what they're thinking and feeling at the time is driving them to do that. And they would come back and say, well, we've had so many nights of bad meals, I just thought I'd give it to them tonight and I'll work on it again tomorrow. It all comes back, all those feelings come back. So we thought, all right, that's what I call parental pessimism. But well, we know in cognitive behavior therapy that we can make people more optimistic, and work like Seligman's work. So he said, well, what if we combine behavioral education, teaching them how to work with their child, with this cognitive behavioral component, teaching them how to think about a situation differently. And so we did a study, and I'll talk about that later, but the point was, can we make parents more optimistic? And if we can make them more optimistic, again, about themselves, about their child's ability to change, then maybe they'll be able to carry out the interventions that we designed for them. That's where optimistic parenting came in. And we can talk more about the design of the study and what we did. And I'm going to apologize to the audience, but I have allergies. So if I go out of the screen and wipe my nose, I apologize.
'Tis the season. Take care of whatever you need to. We're all in that boat. It's so interesting because, as you said, often we make an assumption that what allows kids to, or that the factors that really matter in terms of whether kids improve on the whole or with specific behaviors is the severity of their impairment, or even another one that's often thrown out there is, the intensity of treatment that they've gotten or how much treatment. But what I have seen over the years is exactly what you're saying, that we have kids who come from years and years of intensive, really thorough, all kinds of treatments, that there's not been a lack of education for the family. There's not been a lack of intervention, and yet kids aren't doing very well, or they're not changing. And then we'll have kids come in from families who really haven't had access to anything, and their kids, when you look at the initial assessments, you're like, wow, these are pretty significantly impaired kids, and yet they're doing really well. And so much of it does come down to the piece of how we view the child's capacity to change and our ability to impact that in a positive way, right?
Right. And so, one of the things that we're learning is if you are pessimistic about your child's ability to change, about your ability to do this, that makes you depressed. Mm-hmm. You feel like you have no control. Mm-hmm. And, so if they start an intervention, work quickly, they give up. They say, well, see, I knew it wasn't going to work. And so a lot of what we're doing in the different techniques we use is getting parents to stay in difficult situations. Mm-hmm. So your child is screaming in the supermarket, don't leave. Mm-hmm. Stay there, because if you leave, you may not come back with your child. Mm-hmm. What happens when you become anxious, mm-hmm. people are judging you, and probably people are judging you. Mm-hmm. Our optimistic families say, we had one mom, I did some of this work in New York, who is a typical New Yorker, and her kid was screaming in the supermarket, and someone said, "Why don't you discipline your child?" And she walked over to her, pulled out a card, said, "This is what my diagnosis of my child. Why don't you mind your own?" And then she cursed. Business. And
Uh-huh.
I'm a good mom. You know what this is? I have a plan. I know how to handle this. And you butt out.
Mhm.
Flip side, you have parents who hear that kind of feedback and get very anxious, and feel like people are looking at them and people are judging them. And so they just want to escape. And if you escape an anxiety-provoking situation, you never reduce your anxiety. So a lot of what we're doing is designed to get you to stay and be mindful. And be mindful of good things and be mindful of difficult things.
Let's talk about the research because, so this was an idea or a hypothesis that you had coming out of the work that you were doing, but there's good data behind this. You've studied this now and seen the impact of this. So let's talk a bit about that.
Okay, so what we did once we discovered this kind of pessimism aspect, we actually selected families who were pessimistic.
Mhm.
Families who had children with significant challenging behaviors and lots of different diagnoses, and were also, according to some of our scales, pessimistic. And it's kind of unfortunate because we would get families who want to be in the study to teach them how to work with their child, but they were optimistic and they couldn't be included. So we had to screen them out. The children were between the ages of 3 and 6. They had to be significantly, on scales that we had, have significant behavior problems. And then we randomly designed this clinical trial where we put one group who had, these kids and were pessimistic into just a behavioral education aspect. So we taught them how to look at your child, how to do an assessment. Why do you think they're doing what they're doing? We had formal assessments, teaching them how to design plans and carry through on plans. And then we had a second group who were the same, equivalent group, but we also added in this behavioral, cognitive behavioral component. So we're teaching you not to give your child a cookie at the dinner table, but we're teaching you also how to examine your thoughts.
Mm-hmm.
What are you saying to yourself when this is all happening? And this takes some work. I mean, this is what psychologists do. We look insight, what are you thinking and feeling about these things? But and it was an 8-week session for both of them. But after a few weeks, they started to realize, oh, I'm thinking, I'll never have a normal dinner again. My mother-in-law judges me about how, I'm, spoiling my child and I'm not disciplining. And that makes you do things that you shouldn't do.
Mm-hmm.
So we'd get them to start to look at those kinds of thoughts. And we have about 13 categories of thoughts like that. The other is, if your child has a diagnosis, we often have parents who say, well, he's got autism. That's why he does it.
Mm-hmm.
If you think that, and you're not going to change the autism, then give up. We got that a lot with sleep disorders.
Mm-hmm.
Doesn't sleep, and that's because he has autism. Like, okay, it's not inevitable. We can improve, not going to be perfect, but we can improve sleep in your child.
Mm-hmm.
In the two groups, and they both got the same amount of time with us, so we made sure that those other sessions with cognitive behavior therapy weren't longer. We looked at those two groups. Now, what was interesting at the end of the study, at the end of the 8 weeks, and we followed them up, what we did was kind of picked a problem situation at home, asked them, pick the worst situation you have, taking a bath, getting on the bus, whatever it is, mealtime, and then we scripted it. So that we had them do this over and over again, and we videotaped it. And then after the 8 weeks, and then a year later, we asked them to repeat it, and we wanted to see how the children would change. And what we found at first was puzzling, that both groups, the children behaved better. Mm-hmm. And that was not what we were expecting. We were expecting that the children parents who had cognitive behavior therapy did better. But then we went and looked back at those videotapes. And instead of just looking at what the child was doing, we were looking at what the parents were doing. Mm-hmm. And what we found was, in the parents who didn't get the cognitive behavior therapy, they gave up. Mm-hmm. So if your child isn't going to bed at night, and you're wrestling. We had one mom who just got into bed with her child, put the television on, and waited till he fell asleep.
Mm-hmm.
Not what we taught her,
Mm-hmm.
is what made things better. I let him wear the same shirt every day because he gets upset if he doesn't wear the same shirt every day. And we call that the concession process,
Mm-hmm.
where you start to concede to all these things that your children are doing because it's easier at first.
Mm-hmm.
What we found when parents were more optimistic in the other group, they were pushing their children. It didn't, we had a videotape. So one mom who was trying to get her child, very young child, to put his toys away. And at one point, before, she ended up just doing it herself. After 8 weeks, she was getting to put his toys away and he ran out of the room. And she just waited. And what he was doing was going to his room and getting a book that she would read to him. That was his reinforcer. So he brought the book back. She said, okay, now pick up all your toys. Picked up all the toys, and she would sing while he was doing to make it pleasant, and then cheered when he did it, and then read the book to him. But she didn't give up. She didn't just say, oh, this is too much trouble. She persisted. And what we found when we looked at the two groups, that the parents who got the cognitive behavior therapy approach were more optimistic about their child's future, would be more likely to take them out in public, would have fewer fears about their child's, what their child was doing. And again, we're not conceding. We're not saying, I'm not going back. Mm-hmm. Mom who had 3 kids with autism, and when they got to her father's house, they ran in the backyard, and there were 3 kids and swings, but only 2 swings. Mm. Do the math. They got upset, so she brought him inside, and then she said, well, it wasn't kid-friendly, and they were doing all these things, and I got heart palpitations, which she was having an anxiety attack. Mm-hmm. So now I can't go back to my father's house. It's like, no, that's the worst thing you can do, is not go back. Because what happens as these kids get older, your world starts to collapse, and you go to fewer places. And I've worked with young adults in group homes who run the house, because people are afraid. And so what we're trying to do is catch them early and learn there are rules. I'm going to assist with them. I'm a good mom, and this is another thought that they have, that I'm not a good mother or father. And so that's why this isn't working. So that's a study, and that's the data we got out of it was very encouraging, because we could teach them to feel better about themselves as a parent, and could give them techniques to learn how to deal with those negative thoughts when they come.
Mm-hmm. Yeah, so it's not just about the educating and modeling and making sure that parents know what to do. It's also the education and building the awareness and the mindfulness around how they're doing that, particularly how they're thinking and feeling. And there's so many pieces that go into that. Parents come to the experience of parenting a child with special needs, with all different backgrounds, experiences. We all come to parenting with our own stuff, right? I'm curious, are there some things that you find most often get in the way of parents having optimism?
Yeah, I think, again, some of this is by nature. So there are optimistic people and there are pessimistic people. Yep. And so what we wanted to do is see, can we teach people who are naturally pessimistic? Mm-hmm. And there are pessimistic, what's called pessimistic attributional styles. So if you're a pessimist and something bad happens, you overgeneralize. Mm-hmm. It always happens. And I talk to people about this all the time, and you have to start saying to yourself, well, it doesn't always happen. Mm-hmm. I took my child to the supermarket. It was big, it was noisy. I didn't feed him ahead of time. I didn't give him something to play with while we were there. I said, if you take them to a smaller store or feed them ahead of time, does it go better? And they kind of sheepishly say yes. Mm-hmm. Style is to just overgeneralize. We call it catastrophizing. Mm-hmm. And it was like, that was terrible, so I'm not going to go back again. Went to the pediatrician's office and he was acting out. This always happens when we do that. So we kind of point this out to them, that way of thinking of, can be changed. And that's what we wanted to do with our study and our research, is look at that. And not every parent has the same style. Mm-hmm. Or thoughts. A big one of the biggest one is I have no control.
Yeah.
So, I can't do anything about this. We had a mom who they had a dog, and they had a child, and the dog had a medical problem and was urinating on the floor. And her son would stamp through it. And she's trying to help the dog. She's trying to help the kid. She's just saying, I'm getting so frustrated. I don't know what to do, and I feel like I have no control. That's terrible. If you feel like you have no control, especially in major life things, like at this point in time in our lives where we don't have a lot of control, you get depressed. That's what one of the theories of depression is that you feel out of control. So you have to, and what we do is give them ways of thinking differently about those situations. The mother who, had 3 kids and they were having a hard time at her father's house, we pointed out she had control. She didn't think she did. He kind of rounded them up, put them in the car, saying, he misbehaved. And next time we're going to have some rules. We're going to fix the house so you can wander through it, and you can do this. And feel like, okay, I can do this, and be depressed about it and not be anxious about it. So those are kind of some of the things that we look at. And there are lots of different, like I said, different styles. People feel judged. Some people feel like, why am I always responsible? We had a mom who was giving her son a bath, and he didn't like taking baths, and she was complaining about it. And she goes, I don't understand. We have video of this. I don't understand why he won't take a bath. Well, he got in the bath fine. But she's sitting here thinking, why am I always the one that has to give him a bath? It's 8 o'clock at night. I just came home. Someone else should be able to do it. I don't understand why he doesn't like baths. And then I can't get him out. And he loves swimming, but he won't do this for the bath. Well, he actually got out of the bath fine. And she remembered in our session how it went. And then we said, so what did you do about that? And then she shook her head, held her head, and said, I didn't reward him because I was too busy thinking of these other things. And this is where I talk about mindfulness of good, of how you learn how to be aware of what the good things that are happening. And if we have time later, we'll talk about gratitude. Yeah. And how those kinds of things can help you through these difficult times.
Yeah, and I think you said something earlier too that stuck with me about that seems to be an important piece of this for people, if parents, even from an education standpoint, that, so often they're given a diagnosis, or in the case of, many families, multiple diagnoses, and not that there isn't a discussion around, and there are a lot of things to improve the challenges you're dealing with, and you should expect that these things improve, right? And so lots of parents walk away from that thinking, oh my goodness, this is just something that, I have no control over. My child does these things because of this diagnosis. There's nothing to be done. And that can be a really problematic thought process as well.
Well, and there's also guilt.
Yeah.
In fact, I gave a keynote at the Juvenile Arthritis Association. And this resonated with them because they're saying, my child is in pain, they have painful treatments, and so why should I push him to brush his teeth? Or why should I do this? Because they feel terribly guilty about all of this. And it's going to help your child, help your child become more independent, even though, yes, they have a problem. So, we're dealing with that a lot. We had a mom who had a child with autism, and her approach was give her everything she wants. Cries, give her everything she wants, because this, God somehow put her on the planet with me. I'm supposed to help her, and school was furious because they would hear the stories about how she'd cry and scream and knock her head on the wall, and she gave her cookies, she gave her soda, and they were having a hard time with her at school. So she went through our optimistic parenting aspect, and 3 weeks later she said, I didn't realize I was doing it wrong. She couldn't change. She can. Yeah. And she had severe problems, but the mom said, I look at her now and I said, she's understanding me. She understands what's going on, if I want something, I can't scream and yell and carry on. I have to be nice to my mother. You know, she didn't say that, she wasn't verbal. The mom could see that this was possible. And so that made her more, as she said, more powerful. I'm in control of this situation and I can help my child. And so that's kind of, ultimate outcome we want.
Yeah, I love that. That's great. Let's dive into some of the strategies. In the book, you talk about 10 tips for optimistic parenting. You cover those in lots of detail. Let's focus on a few. You touched on exploring thoughts and feelings and bringing awareness to that. Believing you're a good parent, believing your child can change, these are important factors. Let's touch on the expressing gratitude, because your book was really the first time I had seen somebody pull that component that we know from the literature in, psychology and positive psychology, especially as an impact, had pulled that into this realm of working with kids and families with special needs. So let's talk about that one specifically.
Sure. And give you an example, I teach a positive psychology class, and I have my students do several exercises, but two of them are 3 good things. You have to go at night for a week and write down 3 good things that happened that night or that day. And it could be small things. I found a parking space near my class. A friend, had a great talk with my friend. But we want to kind of get you to focus on the positive instead of the negative. My wife and I would sometimes, when my child was younger, we'd go out to dinner and we'd talk about, we called it him, capital H-I-M. We talked about him all the time, and this happened and that happened and that happened. And it's like, no, we can't just dwell on the negative. The thing that we do in class is called a gratitude letter. And I asked them, pick somebody you always wanted to thank but never did. It could be your grandmother, it could be your mother, it could be your boyfriend, it could be, whomever. Write them a letter thanking them for what they did for you. You have to hand it to them in person. They have to read it to you, they have to read it in front of you, and then process the rest. That has been one of the most moving experiences many of these students have ever had. We had students who, and by the way, if I tear up, I cry at Hallmark commercials, so just be warned. He wrote this letter to his grandmother, who raised him, and he never felt he really thanked her for that. He wrote this letter, she cried, he cried. He came back to my office a year later after he had graduated. He goes, we just came back from a meeting with my grandmother who's dying, and talked about how do you want to celebrate? And she said, read that letter. So it was like, just so moving. And he said, thank you so much for doing that. It's incredible. We had a young woman who overdosed and was taken to the emergency room. Doctor took care of her. She was nasty to the doctor. And for years, felt terrible about how she acted. So she wrote her a note, found her, because she didn't know her name, so she kind of described it. And the doctor was in tears, and it was so moving to this woman who got it kind of off her chest and could thank this person for saving her life and being so kind to her when she was being so rude. So, for parents, we'll often say, is there a good teacher? Instead of focusing on the bad teachers you had or the ones you didn't get along with, are there some that were really great? And did you ever really thank them? And do something like that for them, because this means the world to teachers. You hear that. I know when I get good feedback, I show my wife. It's like, look what the student said, about my class. So the gratitude part is really important. It makes you focus on the positive, again, that there are some good things out there. It also makes you feel better. And the research says it can reduce depression for a month or two if you're having a difficult time. So, it's helpful for parents to kind of focus on that and not have to always focus on this went poorly. Let me kind of do a side note here. We've also talked about, and we haven't done it, but optimistic teaming means working with both the parents and the teachers to listen to each other. So I give the example of a parent who gets a letter from school saying your daughter tantrumed in the playground. What's the mother thinking? Mother was thinking, I must be a bad parent. They're blaming me for my child's behavior at school. So what does the parent do? Parent doesn't write back. What does the teacher think? Teacher thinks the parent doesn't care. So we try to, get inside of their heads to see this is why she's doing this. This is why the teacher is doing this. And can we kind of find some common ground so that you understand how this affects you? So can you say, yes, she tantrumed, but then, she stopped and we did well, and kind of reflects positively on the family. So it's a thing that can get beyond just the family dynamic and work with other people.
I think that's so true. Often, when I was, a teacher myself, and certainly when I consult with educational settings or, those kinds of environments, one of my rules is that you have to provide as much positive feedback to the parent about the day or the situation as you are negative, because doing the work that I do with families and with parents, you're so right that often as professionals, we don't realize the profound impact that has on parents and how that feels to them and where they go in their own mind with that. So I think that's such an important point. And speaking of that, where we as parents go in our own mind, which we often are not even, paying attention to, that's such an important part of this, right? And so many of the examples that you've given, being aware of what our thoughts and feelings are about the situation. In the book, you give lots of strategies for that. What's a starting point for our parents who are listening, or even, the professionals who are listening too? Is there something that you think is a helpful starting point for people to be aware of that internal process?
Well, again, it is practicing being aware. So, we have families do diaries. So we have a thoughts diary. So we say, pick a situation that happened, like a negative situation and a positive situation. Write down what you were thinking while that was happening. So I feel out of control. Was it, it's the disorder, people are judging me. Why am I the one always responsible? So write that down so you can practice thinking about those things. But we also have them write down positive things. And what are you thinking about at that time? And the bathtub example I gave was one where the mother initially had it down as a negative, but realized it was a positive. And because of all these thoughts that she had, she wasn't being aware of it. She wasn't really paying attention to what was going on. So we have people do that. I'm a runner, and I was sitting in the park, sitting on a bench because I was tired and hot. And I saw this mother walking with her young daughter and holding her hand, but on the phone with a friend. And the daughter said, "Look, Mom, a bug." And the mother said, "That's nice." She goes, "Look, Mom, it's a green bug." She goes, "That's nice." She keeps talking on the phone with a friend. She goes, "Look, Mom, a shiny green bug." And finally the mother said, "Okay, that's nice." And then the girl hit her. And she said, "Why did you hit? I'll call you back. Why did you hit me?" And I wanted to say, "I know," because she wanted to show you and impress you. She might have been a world famous entomologist someday, but you were too busy on the phone. And this is where we get into mindfulness again. Be aware of what's going on with the children. We have this tendency, as a parent, when your child is being good, you're off doing something else. You're making dinner, you're calling a friend, because now you get a break. But that's also the time where you should be focusing on the good things that have happened. You don't have to do it all the time, but practice thinking, being aware of what you're thinking. And then we have a number of techniques where we can help them break those thoughts and break in so they don't happen to them.
Give an example of a strategy that you use for that, because I think people are like, oh yeah, how do I do that? I'm aware, gosh, as I'm thinking about it, I do tend to really focus in on the negative, or I have this story that runs in my mind about why even bother, this isn't going to get better, those kinds of things. What is an example of something that you teach parents to do to shift that?
Well, one of the techniques is called distraction.
Mhm.
So we had a couple come in, and this is the one who had 3 kids with autism. And she goes, kids are bouncing off the wall in the house. We're blaming each other. Why did you do this? Why did you give them candy? What? And I said, come up with something that would just distract you from these negative thoughts. And they thought for a minute, and the mom said, yippee-ki-yay. And I didn't know what that was. The facilitator there didn't know what it was. The facilitator thought it had something to do with their sex life. But it was from a movie. And it was Die Hard with Bruce Willis. And before he was going to shoot somebody, he would say yippee-ki-yay, and then he would say something I can't say, but it made him laugh. It was like, oh, just shoot them all, And it was like, okay, this is a bizarre situation. We have 3 kids who are all over the place. How bizarre is that? And by the way, other families have the same situation. But we can either bicker with each other, or we can just say, all right, this is bizarre. Let's move on. Let's see how we can get things under control. So distracting thoughts that pushes you away from, blaming somebody or feeling bad about yourself, and just say, this is bizarre, and so we'll deal with it. So that's one of the techniques. We also have some others, like this substitution, where we give them other thoughts to think about. We have one that's kind of an affirmation that basically you say to yourself, I'm a good parent, I'm doing the right thing, this will get better over time. And so you practice the positive parts of it.
I think that piece about, telling yourself you're a good parent, because one of the tips is to believe you're a good parent. And that can be so hard for moms and dads to do, especially if you have a really challenging child. A lot of people equate their sense of being a good parent to their child being happy all the time, right? So when the child is distressed with anything the parent's saying or doing, or any limit that they're setting, immediately the feedback, that the perception on the part of mom or dad is, I'm not being a good parent because my child is upset right now. And what you really are talking about is that being a good parent and believing we're a good parent means recognizing that our kids aren't always going to be happy with what we're doing, and that's not a reflection on whether we're a good parent or not.
Right. And it's the outcomes. I mean, I used to joke, my son was a difficult child. It took him about 35 years to grow out of that phase. No offense to everybody, and sorry about the dismal outcome. But when he was difficult, my wife and I would have this conversation about, are we doing the right thing? We're dealing with this. I said, he's in school. He's doing okay in school. If it wasn't for us and towing the line, he could be in jail right now. He could be involved with drugs. And so there's always somebody out there who's got it more difficult than you do. So I just said, we're doing fine. We had a child who was born difficult. He wasn't born with a disability. Born difficult. Even early eating and sleeping. How I got into sleep disorders is my son's sleep. So it was like, but we keep persisting. And like I said, 35 years later, he likes us.
Success.
Yes. But, in fact, when he went away to college, he said, I'm the only one in my dorm. I'm the only male in my dorm who knows how to make a meal and laundry. He goes, I don't know how to do that, because their parents were just trying to be friends, and it's difficult. And, he was fight with us about doing those things, but he then kind of agreed that it's a good skill to have, and I have more than my friends do.
So it's that reframe of being a good parent, or how we feel about ourselves as a parent, needs to be more about the long game and the outcomes, and are we persisting and trying and persevering, versus attaching our sense of ourselves as a good parent to whether our kid is happy in the moment.
Right. Well, in the book, I give the example, I used to do marathons. And in one marathon, I was at mile 20. And if you know marathons, I had 6.1 more miles to go, 6.2. And my back hurt, my legs felt like tree trunks. I could see the ending 6 miles away, and I thought, I'm never going to make this. It was like one foot in front of the other. And then I could hear someone shuffling just a little bit faster than me behind me and past me. And he was about 90 years old. I thought, this 90-year-old guy is going to beat me to the finish line. And any kind of energy I had was just like washing away. But on the back of his shirt was a quote, and it said, pain is inevitable, suffering is optional. You're going to hurt. You deal with that hurt, it's up to you. I then started to figure my wife's going to be at the finish line. I get to eat and drink anything I want today, you know. And so I kind of refocused, except not on my pain, on all the good things that were going to come. And it worked to the end, miraculously, because I didn't think I had it in me. So that's the kind of thing. Pain is inevitable, but suffering, how you deal with it is up to you. And so when you're challenged by your child, I can choose to kind of focus on all the negative things, or I can choose to look at the future. I can choose to say I'm a good parent, because not a lot of parents can handle this. I'm handling it. So it's a way to get to that finish line. And that's kind of what this is. It's like they say, it's not a sprint, it's a marathon.
Yeah.
And, you know, so you may get through it today and feel like it didn't go well. You've got tomorrow. And so you have ways to improve. And this is where you have social networks too, where you get to talk to people who can, bolster you up and say, really impressed with what you're doing. That's very important. And, again, the gratitude about what we have and where we are. We're alive, and especially today, we're alive.
Yeah. Such helpful and important reframes and things to think about, and some very tangible starting points for people. I want to make sure that our listeners know where they can find out more about your work and your books.
Okay. Well, on my website at the University of South Florida, St. Petersburg, I have my data and some description of the work. But Amazon carries all my books. So I have about 15 books. Some of them are textbooks on abnormal psychology, but the Sleep Better book is there. The Optimistic Parenting book is there. For professionals, I also have this series of protocols. So a professional who may want to do this with families, the protocol is written out step by step by step, each session. They're on there. It's called Positive Family Intervention. I don't use Optimistic Parenting for the professionals, but it includes all the assessments. There's also a parent workbook that goes along with it if they want to use that. And so Amazon, you can look my name up, and I have a page of all the books that I have. So that's another way to find it.
And we'll have the links to those books in the show notes as well, so people can access them. Highly recommend them. I'll try to twist your arm and have you come back on the show at another time to talk about sleep stuff, because that is profoundly important work, and that book is great too. But highly recommend that all of you check out Optimistic Parenting and the other resources that Dr. Durand has available. Can't thank you enough for taking the time to have this conversation today. Really appreciate it.
Oh, my pleasure. I wish everybody well.
And thank you to all of you for listening. We'll catch you back here next week for our next episode of the Better Behavior Show.